Swadikap, good noon. Today is Wednesday, the 10th of February 2021. I'll just start off first by welcoming back one of our other MCs, Kun Fluk Pawina here. She's back like the other MC that we had welcomed back last time. So Kun Fluk and Kun Jack were in quarantine for 2 weeks because of the case that we found. So just to reiterate again that we practice what we preach. We take very seriously when there are any risk factors. Just like the way that we tell you every day about the risk factors and all the measures that we have to strictly adhere to until today. So first of all, starting with the daily numbers, the daily cases confirmed. For today, we have 157 cases confirmed, out of which 106 are from active case finding. And new recoveries for today stands at 548. You can see that the new recoveries surpass the new confirmed cases right now. The total number of cumulative cases is over 23,000, and recoveries, those who have been discharged already, is 18,000 plus, almost 19,000. And to report to you today, we have one new fatality, unfortunately. A 65-year-old female woman with medical complications, larynx cancer, and a history of contact with infected members of her family in Samut Sakhon province. And we'd like to express our condolences to the bereaved family of this woman. So the spokesperson, Dr. Tui Sin, had recapped a lot of information that we have in terms of the numbers for each provinces, the cases that we have for today. I'd just like to highlight one important information is that, of course, we've been performing our missions on active case finding. We had the peak of that in the last weeks, and in the past few days, we've sort of like slowed down a bit in terms of the active case finding, because we've reached actually almost all of the target groups already. So the peak of the active case finding had around 10,000 targeted persons per day. We've decreased that to around 5,000 per day. During this time, we are confirming whether the people who have been tested would have built their antibodies and their immunity towards the virus yet or not. But in the meanwhile, as we scale down the active case finding mission, we have put in place the bubble and seal strategy in that place. So the bubble and seal strategy, as I explained yesterday, is about sealing the various factories and preventing too much movement of people from targeted areas, from risk areas, to go outside and travel back and forth. So the bubble and seal strategy is in place for many factories. From now on, there would be around 7 factories with around 10,000 targeted persons that would be in the bubble and seal strategy. 7 factories with 10,000 people per factory. So these remaining factories would be in the bubble and seal strategy for us to be able to control the spread of the virus as we scale down the active case finding missions. So just another interesting point of information is that yesterday I mentioned about the various TV programs at 2 p.m. that we have every day in Thai on different dimensions of COVID. I'll just sum up one of these programs. Yesterday, the 2 o'clock program, there was a program on various issues. Also, in conjunction with the programs, there were also, of course, the briefings by the Ministry of Public Health. And one of the health experts discussed the efficacy of vaccines. So in summary, that once a person receives a jab, the level of immunity in the body will be boosted for a certain period of time. But it does not mean that those who have been vaccinated will get infected or that they can't pass the virus on to others. the person can and will get infected if exposed to the virus. Immunity against the virus will have been developed to a sufficient level that even if the person gets sick, the disease will most likely not be life-threatening. So this also means that once vaccinated, the person is still restricted from traveling freely as before and restricted from mingling with others. The strict social distancing measures still need to apply in all cases, as the person who had been vaccinated can still pass the virus on to others. So therefore, vaccines are not a fix-all solution to the COVID threat. We still have to adhere to the DMHTT and other principles as always. Another piece of information for the English language audience is a little bit about Thai Chana and Mo Chana, wherein Dr. Thuisin had mentioned this from time to time. Just these two applications, you're familiar with them already. Just in terms of users' benefit, the Thai Chana application will receive notifications once people have visited the same location and in the same time of an infected person. While the Mo Chana application, in terms of users' benefit, would be to receive notification of at-risk locations and infected persons' travel route in detail to manage their own risks. And regarding benefit in terms of, regarding privacy and safety, the personal data in both applications are protected by law, by the Personal Data Protection Act, or PDPA, and information is used solely for the purpose of controlling and preventing COVID-19 spread and other communicable diseases. So the Thai Chana uses check-in and check-out locations QR code to obtain data, while the Mo Chana uses GPS and Bluetooth technology to track locations of users and show whether they have been visiting in risk areas or not. Every briefing I end with some good news. So in terms of rankings of Thailand on the world stage, lately there had been a number of rankings despite the challenges that we have to face. So the Foreign Ministry and the Public Health Ministry announced our ranking on the world stage in areas of public health. And I'll just recap some. There are many, but I'll just recap some for you. First, the Pemandu Associates, in cooperation with the Ministry of Science and Innovation of Malaysia, ranked Thailand first out of 184 countries for recovery and response to the outbreak, and the best score on the Global COVID Index, or GCI. Second, and this was announced earlier in the other briefings earlier, Australia's Lowy Institute ranked Thailand fourth out of 98 countries for management of the COVID situation in the country. Third, the Johns Hopkins Center for Health Security ranked us sixth in the world for health security. And lastly, fourth, the Nombeyo survey, which is the large database of users contributed data about cities and countries worldwide. They ranked Thailand eighth in the world as the country with one of the best health systems in the world in 2021. Schools have opened, of course. Many children have been going to schools already in the past week, and we've talked about the items, the precautions for the schools, back to school items, and you have that on screen for you. The various items that parents should be preparing for children to take to school to continue our precautionary measures against COVID. So this is the information that I have for you today. Some of the briefings in these past days might be briefer than the other days in the past, but we'll try to recap the information that the English language audience viewing from Thailand and from around the world through social media that you should be aware of. But most especially is, of course, the measures that we continue to talk to you about every day. The situation seems to be slightly better than compared to the other weeks past because of our active case finding missions. If we solve Samut Sakhon, we'll be able to solve the situation for practically the entire country. So hoping that we'll reach that point very soon with your cooperation. So thank you for your attention. Hope you enjoy the rest of today. We'll have a long weekend, Friday, Saturday, and Sunday for Chinese New Year, as I mentioned yesterday. We might not be on screen on those 3 days, just a short break. But meanwhile, please stay safe, wear your masks, and take care of one another. Thank you. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะ